Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Welcome back to This Just In Radio Show, broadcasting live from HIMSS 25 in the AMD booth in sunny Las Vegas. I'm very excited to introduce my next guest. Didn't realize this is also going to be my final guest for this broadcast.
So are you saving the best for last?
I am. Of course I am, Tony.
All right.
New friend of the show, Tony Black, Global Director for Healthcare, Privacy, and Digital Transformation with Kyndryl. Welcome to the show, my friend.
Thank you. Glad to be here.
Before we go too far, hair and makeup, are we good? Are we both all right? And you powdered up? No shine? Okay. Fantastic. How you doing, my friend?
I'm doing great. How about yourself?
Fantastic. When did you get in town?
I got in on Sunday afternoon.
Same here. Did you have the crosswinds at all? Did you get the plane? We also almost crashed coming in. We had our jet boarded the landing and had to circle around.
Well, we were a little bumpy.
Okay.
Yeah, they sat everybody down. They took the snacks away, and everybody was buckled up for the last 30 minutes.
Yeah, so we were not. Yeah, actually, we flew in from Sarasota, but went through L.A. and they wouldn't even let us out of our seats from L.A. to here. And then we had to abort our landing. I was texting all my friends. I love y'all. You know? But it's good times though. What do you hope to achieve while you're here?
Well, definitely want to meet as many clients as we can, have as many valuable meetings as we can.
Yep.
Talk about strategies with partners, like yourselves, as well, and then have steps for processes for going forward after the conference.
Yep. So, I guess specifically, what are your looking out of the room? What are you most excited about seeing, and who's here right now?
Well, a couple of key things that I'm pretty excited about is AI.
Yep.
Generative AI, that's a big deal.
Absolutely.
Also IoT, Internet of Medical Things, as well as sustainability, right? So those are three big things. So with the generative AI, I mean, the biggest thing there is that technology, that data can create new things based on data it's already learned. Yep. Right? So it can improve the way doctors create personal treatment plans. Absolutely. And also faster drug development. Right?
Excellent.
And IOMT, that's a huge thing, right? I mean, AI and technology is in solutions more so than it ever has been before.
Very true. What's Kyndryl's goal? So tell me about Kyndryl a little bit. I've heard about them. I've been friends with AMD for a long time, even AWS. But tell me a little bit about Kyndryl.
Well, Kyndryl, we focus on infrastructure services.
Okay.
And our goal within the healthcare industry is to work with the payers, providers, pharmaceuticals, biotech firms to help drive efficiency, to help them focus on patient outcomes. And be able to deliver much faster, higher quality. Yep. So
Excellent.
we're driving value.
Yep.
That's the thing. That's the key. If you're not driving value, then what are you doing?
Yep. Yeah, I completely agree. Certainly nowadays. I mean, that's actually doing more with less is one of the themes a lot of my guests have brought up. We're going to be entering a new phase, and a lot of us, we need to embrace it and accept it and actually be happy with it. Create a more efficient, maybe more effective healthcare system moving forward. So
Absolutely.
And that all comes down to value for sure.
Absolutely.
So what trends, kind of dive into some of the questions, what trends are you seeing out in the industry that we need to be ready to navigate?
Well, you have things like AI-powered tools that are driving things like ambient listening, diagnostic imaging for increased efficiency.
Yep.
Also, value-based care, a shift from fee-for-service models to value-based care models, emphasizing patient outcomes.
Yep.
A greater focus around health equity initiatives and mental focus. But you also have technology leaders who are actually trying to need that new approach between driving home privacy policies and implementing the cybersecurity rules and goals and practices with them.
Yep.
And then also the business leaders, right, who are actually using data to increase and achieve goals.
Yeah.
So you have CIOs thinking more like CFOs because they need to get rid of the silos and drive transformation.
Right.
And that's really key, driving transformation because that involves modernization, and efficiency.
Yeah.
So that's really what we're trying to do.
So kind of feeding on that, I completely agree. So what are some best practices to move in that direction? Would you give to a CIO or to CTO or healthcare system in general?
Well, a couple of things. First thing is we need to simplify the platforms and create and invest in better models to help us collaborate more and closer and support more with clinicians and clinical workflows. Yep. And then the second thing is I'm a big governance guy.
Yep.
So being big on governance, my technical side says we need to address standards, methods, frameworks, and models. But you also look, my privacy side says you got to be concerned with policies, processes, procedures, and compliance. So any solid business plan or business strategy is going to have those elements in their governance plan.
Yep.
So as you address an area or function that's broken or in need of something, you need to create and address a plan to drive that practice, to drive that behavior, supply the people who are responsible for it with tools and resources so they can adopt it.
It's excellent.
And then you got to make management and leadership accountable for it to drive home the importance of it. Because if people don't think it's important or they don't think it's primary, they're not going to focus on it.
Absolutely.
And it's going to hurt you when you try to be valuable and beneficial to the industry.
Yep, very excellent point. I guess following up on that, what are some examples that you work on today in that direction? So give us from Kyndryl's perspective.
Well, from Kyndryl's perspective, we work closely with a lot of payers and providers, looking at addressing their business challenges, looking at their goals and what they're trying to face, and then we try to find the gaps and the nuances of where we can actually implement some efficiencies and some growth, and to help them move forward, reduce waste, reduce time, drive value, and drive benefit.
Love it. Excellent. So thinking beyond today, what's a couple of strategies from 2 to 3 years from now that we need to be ready to navigate?
That is a good question.
It's a hard question.
Well, the first thing is Kyndryl did a readiness report, and we found out that the majority of healthcare leaders believe that their IT systems are best of class today. Their current IT infrastructure is best of class. However, only a third of them think that it's built for and ready to manage future risks. So future-proofing for hospitals and their facilities is key. The second thing, I'll sum it up with this, is the growth and evolution and maturity of AI. As we go along this AI journey, we continue to have to evaluate, reevaluate, and know where to make adjustments as we define and redefine our needs, goals, and wants. Because that journey is going to continue, so we need to address that. Because information awareness and knowledge we want to keep, but you have to couple that with responsibility, accountability, and trust.
Yeah.
And that's really key, because you don't. The other balance is as you look into that, you want to keep and maintain the innovation and creativity of that AI delivers, but you still want some management and control out of that.
Absolutely.
So things don't get out of hand. Because you still want to be able to drive and move forward in a planned manner. Right.
So think about, actually to follow on there, because we have an extra minute or so, what would you be most excited about with GenAI? Because when I think about GenAI, I love what it does for care and automation and efficiencies there, but I'm actually an interoperability guy, kind of back in my past a little bit too. I'm looking forward to how GenAI can help us with data interoperability. But what are your thoughts?
Well, that's key. That's big, because that's always been a problem, right? As when you look at the healthcare ecosystem, payers, providers, clearinghouse, medical device manufacturers, pharmaceuticals, biotech firm, as you navigate as a patient, your data is traveling through the entire ecosystem.
Yeah. Hopefully.
Exactly.
Hopefully,
all of those systems, all of those teams, all of them looking at it with a different lens, a different perspective, but the systems aren't talking to one another.
Right.
So if GenAI can help drive better interoperability and solve that problem, that's key. That's a home run.
Yeah.
You know what I'm saying? That's a grand slam.
Absolutely. So when you think about GenAI, what would you like to see? What problem would you love to see it solve specifically for you and your thoughts?
Probably the main thing would be the data interoperability. Good. So because that's the ecosystem. So that needs to be smoother. It needs to be more efficient. It needs to be more secure, and we need to control the accessibility and the security around that.
Right.
So those are key elements and areas that need to be paid attention to with data interoperability.
Yeah, and we had a dinner Monday night with actually AWS, and we're doing a whole clinical research strategy on pediatrics and oncology. And one of their big calls to the market is to use FHIR as a standard. Because we aren't going to recognize the promise of AI if we don't have interoperability. And so we've got to do that at a higher scale, and certainly get these institutions doing that, even on the research side, because that's where we want to, we can cure cancer much more quickly if we have that interoperability and we start to share our data and monetize it together in that capacity for care. So. Anyhow.
I agree with that 1,000%, but I didn't get an invite to the dinner.
The dinner, I know.
What happened?
We just happened to host it. It was good. It actually kept working out. It came together very quickly. In your closing day, what are you going to do here? What do you look forward to doing in your closing 24 hours here at HIMSS?
Well, we're all going to meet back with our leader, Trent Sanders, and we owe him 5 key new ideas that we're going to go home with.
Oh,
And that's what we're going to do, and that's what we're going to drive forward. Those are the next steps after this.
You should have been my first guest, because that would have been a great question to ask. What are 5 new ideas you're going to leave HIMSS 25 with?
See, if I was first, then people would steal that.
They'd
They would
steal your
take
idea.
that.
I know, I love that.
Then I can't claim it.
We're going to add that to our next show. I'm going to ask, what are your 5 ideas that you're going to leave? Or what do you want to see? Or in my last show, I asked them, what did you learn? What are the 5 things you're going to leave here with? I like that. Fantastic.
See, I'm giving you a little something.
You are. Tony Black,
we'll keep up
Kyndryl.
after this.
Thank you, my friend. Great to have you on air. Appreciate you, man. Thank you.
Awesome.